Hello, my name is Cosette, and I am the Communications Instructor at the Faculty of Nursing at the University of Manitoba. This presentation, Literature Review Writing Strategies, is the second in a series of instructions about how to write an effective literature review, or review of the literature. This presentation will show you how to effectively use writing, academic writing, to synthesize various sources that you have been reading on your topic. It will also show you how to effectively use the American Psychological Association's 6th edition in order to cite those sources in the body of your paper. The example or exemplar used is the research question, what makes a good nurse good? So for instance, one of the common findings in a literature review is that several authors are consistently saying the same idea. This is a known or a general trend in the literature. For example, the student found that the literature consistently stated that the important personal characteristics of a good nurse are related to the nurse's ability to be caring and kind. The information in the blue is the student's finding about all of these different sources. Here there's 1, 2, 3, 4 different sources, as we see from the years. Another way that we could indicate a general trend or something consistently found in the literature is by using these phrases in the place of the literature consistently states. In other words, any of these phrases might be substituted for the phrase at the beginning of this statement. I'd also like you to notice that when you are listing multiple sources, whether there's one author or several authors behind an idea, or stacking sources as some students call it, those sources should be listed in alphabetical order by the first letter of the first author's name, not in chronological order. You may also find when you're reading through the research literature that just a few studies have similar findings. When you set these up, it's very similar to a paraphrase of one source. So for example, 2 studies found that the ability to communicate and have common sense are desirable characteristics of a good nurse. You may list those sources in brackets or parentheses at the end of that statement or at the beginning of the statement. In this case, you will have several ands, not ampersands. You'll have several ands and a verb, in this case, argue. Argue that the ability to communicate and have common sense are desirable characteristics. Dissimilar findings are quite common when reporting research literature, and there are a number of ways to represent these controversies in the research literature on your topic. One way is to use the word while and a comma. So for example, while these 2 sources, Davis, Hirschenberger, Gahn and Lynn, and Smith and Godfrey, stated that kindness, compassion, and good character are the most frequently identified qualities of a good nurse, comma, Rush and Cook have a different idea, a contrasting idea, for they claim that being respectful is one of the most significant qualities of a good nurse. Another way we could represent this contrast, besides while, here's another example of while, is by using although. So you might say, for instance, although Vernadsky and Hebert found the nurses report having a good sense of humor, comma, this contrasting source by Francois and Bernard, their research indicates that most nurses are serious at work. In the place of although, you might use phrases like despite the fact that, when, or if, but using the same sentence structure to indicate the contrast between different sources. Another way to show contrast in the research literature, 2 different ideas, is to use but and yet. So for example, nurses must have good communication skills, yet few nurses have taken formal communication courses. The first idea from McPherson is contrasted by the second idea by Allen, using yet in this case because the second part of the sentence, that few nurses have taken formal communication courses, is unexpected or a surprise. Therefore, but shows the contrast and yet shows that the second part of the sentence is unanticipated. Another way that we can show contrast or differing ideas in the research literature is to use the words however, nevertheless, or nonetheless. Do notice, though, that when using however, nonetheless, and nevertheless to connect two complete sentences, the punctuation is a semicolon before however and a comma afterwards. So, for example, nurses must have good communication skill, McPherson's idea, complete idea, semicolon, however, comma, few nurses have taken formal communication courses, which is Allen's idea. Another important factor in a review of the literature is to point out any holes or gaps in the research literature. This may be done as a separate sentence or as part of the same sentence. Let me give you one example. In this case, good clinical skills are noted as a characteristic of a good nurse. This is a finding from these three different sources, Resnick, Russian Cook, and Smith and Godfrey. David and his colleagues expand upon this idea when the student says, specifically, clinical skills are highly important. However, this information in blue is the student's critique or hole or gap in this research literature. The student states, however, the literature on good nurses does not define good clinical skills, nor does the research report the important fact that an unskilled nurse can make the patient feel uncomfortable or even frightened. Another example of how a student might critique the literature, show a gap or a hole in the research literature is shown here, where the critique is part of the same sentence. So, we are using the same strategies previous with while or although, for instance. While some researchers, in this case Bandura, Rogers, and Seifert, define the benefits of meaningful work for employees in general, comma, here's the idea from the student. The existing literature does not explore the advantages of meaningful work for healthcare professionals or nurses specifically. So in other words, it may be part of the same sentence, or it may be a comment that follows a series of sentences on what you found in the research literature. Some assignments in the Faculty of Nursing will ask you to link your practice to the available research. When this is the case, you may find these examples very helpful. Phrases such as, given the importance of, in this case meaningful learning to increase student motivation and task persistence, which is the idea of these four authors, comma, here's the student's idea. It's important to provide relevant and practical clinical teaching to clients. In the place of given the importance of, a student might use since, based on, taking into account, and instead of saying it is important to, a student may write it's integral to, it's necessary to, it's essential to, or it's fundamental to. All examples of fine academic language. Okay. You may also provide your link to practice in a separate sentence. Here's an example. In this case, the second sentence, therefore the nurse should provide clients with relevant and practical clinical teaching in order to motivate them to take their medication, is the student's link to practice. The student may go on to say how the nurse could accomplish this. The importance of a literature review is to demonstrate your thinking. What does the research tell us? What should the nurse do as a result if you're linking it to practice? And how will the nurse do that? I often have students ask me questions about what is the correct tense in a literature review. Do we state our authors in the present tense with state or states, or do we state the research literature in the past? The important factor is that you are consistent. So either consistently state your research literature in the present tense or consistently state it in the past tense. Take a moment to read through each of your citations in the literature review to make sure that they're consistent in the same tense. Another important factor is to match the subject and the verb. So for example, Ashcroft is one source, one author. Ashcroft states. Whereas Ashcroft et al. Is Ashcroft and her colleagues, so it represents they. They state without the S. If you have different sources such as Ashcroft in 2008 and Dean in the same year, it also represents they. They state. For further information on sentence structure, you may also consider looking at my part of the Faculty of Nursing website, where you found Writing a Literature Review, What Should I Do? Also consider checking out the section, What is Academic Language and What Isn't?